من الشيطان الرجيم. بسم الله الرحمن الرحيم. قل هل أنبئكم بشر من ذلك مثوبة عند الله من لعنه الله وغضب عليه وجعل خنازير وابتغوا أولئك شر مكانا وأضل عن سواء السبيل صدق الله العظيम। तर्जुमा। ये कुरान पाक में बंदर का जिक्र कम से कम 3 मरतबा है, जलील ख्वार और सूर से मुकाबला करके। मैं इस आयत का तर्जुमा पढ़ देता हूँ। कहो कि मैं तुम्हें बताऊं कि खुदा के यहाँ उससे भी बदतर जजा पाने वाले लोग हैं। वो लोग हैं जिन पर खुदा ने लानत की और जिन पर वो गजबनाक हुआ और जिनको उनमें से बंदर और सूर बना दिया और जिन्होंने शैतान की परस्तिश की, ऐसे लोगों का बुरा ठिकाना है और वो सीधे रास्ते से बहुत दूर हैं। सदक़ल्लाहुल अज़ीम।
Jazakallah. Before we start this webinar, I'll ask everybody to mute themselves so that we don't get disturbance. And on behalf of PMA, on behalf of Azad Jammu Kashmir Medical College, and collaboration of Women Medical College, Hyderabad, I'll request Professor Mulazim Bukhari to please carry on with your presentation. It's a very important topic, very pertinent, and nowadays we are facing the threat of monkeypox. So we'll be hearing you from him. Thank you, Mulazim Bukhari sahab. Please carry on.
Bismillahirrahmanirrahim. Thank you very much, Professor Qazi Sahab, Dr. Qazi Sahab. After I think 1 or 2 months, we are restarting our webinars. This is basically academic activity, purely academic activity, and nothing present in this activity, any political or any other issue. And inshallah, we'll weekly continue this one. Nowadays, we are facing another threat. The government of Pakistan has warned the peoples, because nowadays this is becoming this monkeypox is becoming prevalent in non-endemic area. I will discuss everything. And very luckily, just I was talking with NIH Major General Ikram. I asked, is there any confirmed cases in Pakistan? He said no. Another question I asked from the Major General Ikram, is there all PCR facilities, diagnostic facilities available in Pakistan? He told yes, the Pakistan is ready to face any of the threat from the monkeypox. Just you all know the monkeypox, that this disease was first started in 1958 in the monkeys and other animals in the Africa. And in 1970 and onward, the cases were seen in endemic areas, not in non-endemic areas, in the Nigeria and in the Africa. But nowadays, from the last 2 years, in 1919, 1920, 1921, and 1922, the cases are being reported in the endemic, non-endemic areas. This is not a new disease. This disease is a little sister of the smallpox, and the same virus, almost genus, belongs to the orthopox virus. You all know that the smallpox was once pandemic in Pakistan when we were in class 4 or 5. Anyhow, now after the vaccination of the smallpox, it was completely eradicated in 1970 and 1980. After that, not a single case was reported in in Pakistan in the world. So that is why the vaccination was not in the same way was given to the people, but the people who are now in 40 and 30 and above, they have not taken the smallpox vaccination. That is why this new virus is attacking them. So basically, in the first slide, this is a zoonotic disease, and it is spreading from the animals to the humans, and now humans to the humans. Same the corona, we saw that this was also a zoonotic disease, and from zoonotic disease, then it mutated and became the human one. We are also afraid. This is very simple way that how it was. It started from the rats and from the monkeys, and with their close association are their scratches, their bites, the consumption of their uncooked meats. This is transferred to the human, and from human to human, we will discuss in detail. This is now the latest data in the world, around about more than 100 cases. This is the list in this area. You are looking the confirmed cases, suspected cases, and very interestingly, that in America, this is the case of the non-endemic area, but this was sorry. Sorry, this in non-endemic area now it is increasing. Australia, Belgium, Canada, France, Germany, Italy, Netherlands, Portugal, Spain, and most commonly that is the important case that can come in Pakistan, that the United case, London. We heard that one case came in Pakistan, but that case was not confirmed. This is the presence of 28th May 2020, that about 21 countries in the world. That is why the WHO is warning, and that we arranged this webinar to create the webinar, that you should be careful, because the corona has told that we must be careful whenever there is any threat of this one. If we are aware, we can control this disease. So the pathogens, I discussed this. This is the same virus that was belonging. And this virus is divided into two parts. One is the Central African part, that is, and other is the West African part. The West African part is more dangerous. The mortality is more in the West African as compared to the Central Nigeria and other things. While this is only one country in the Cameroon that contains both type A and type 2, this monkeypox virus. Various animal species that we will discuss one by one have been identified, and these are like these squirrels, these rats, these monkeys, these animals. So these are the animals that are responsible for spreading this one, because these animals can be in contact with the humans. How? How can they spread from humans to the animals, to their blood, their body fluids, their contact with the cutaneous, their hairs, their especially very important is that some people, if they are taking the uncooked food, meats and animal products, they should be very careful that this disease can be spread to the humans. And if once in the human can spread to the other areas. The people living this is the WHO report, that this people living in the Africa, more in the forest area, they are more prone to suffer this disease. So very important that in interestingly, this is very interestingly first time see that the more commonly seen until now 20 at 33 cases, they are homosexual. That is very important there in the UK. One person came from the Nigeria in the UK, and after that, now around about 33 cases are reported. These all cases are Males, not a single case now seen in the female, but they
जी,
can spread from the male to the female. And uh, other source of other way it can spread, yes, from the respiratory tract infection, from the physical contact, from the skin disease. So this can be similar. I will request other people to mute their mics. There is something. Please mute your mics. So there is another way can spread from physical contact to the droplet infection and contact to the skin, human to human skin. And very important is that the people who have low immunity, diabetes, autoimmune diseases, vitamin D deficiency level, and the people who have not taken the smallpox vaccine. As I told you that after 1970 and 1980, when there was complete eradication of this smallpox, there is no trend to get the smallpox, even in not in Pakistan, all other country. That is why this disease is spreading. Now, can this disease spread from the pregnant woman to the baby? Yes, this virus can spread through the placenta, but the good news is that it cannot spread from the breast milk. The, what are the signs, symptoms? Incubation period is 5 to 21 days, but it can prolong for the 4 days. This depends upon the type of the virus. Either it is central virus, Central African virus, or it is the West African virus. Usually the symptom starts after 5 days. And very important thing is to differentiate this disease from the smallpox disease and other diseases. The important thing is that the fever is common in all other diseases, headache, intense headache, but very important thing is the lymphadenopathy. This lymphadenopathy is the only important thing, that the cervical lymph node are enlarged, the axillary lymph nodes are, these lymph nodes are not enlarged in other diseases. So these are the different, uh, when a patient comes to the physician must take the history and take the clinical examination and concentrate that if there is no lymphadenopathy, then he can suspect the smallpox, chickenpox, measles, and skin allergy and the drug allergy and other diseases, very mimicking to the this disease. So 99% of the patient, this divide symptom we divide into two parts. One is the acute phase. In acute phase, you will see the, as I told you, the fever, the headache, the myalgia, the backache, the lymphadenopathy, and the tiredness. And while in the second phase, that second phase is called the eruptive phase. The eruptive phase means you will see the eruption on the skin. These are decided. First of all, there is the macules, the reddish macule. This starts appearing after 3 to 4 or 5 days of the fever, of the onset of the disease. But once again, I will let you know that these symptoms depends upon the immunity of the patient. That is why we concentrated in our continuously in our webinars, we are telling you that you keep a balanced diet, you keep your normal level of the vitamin D, you keep control of the your blood pressure, you keep control of diabetes, your diabetes and sugar level to maintain at this well. After 1 day, then there will be papule, then the vesicles are filled with the fluids, then the pustule filled with the pus, then the crust and the scales. So this is the stage is how it was, how it appears after. Another good news is that this disease is a self-limiting until and unless the patient is suffering with the immunity problems and the children's. That is why the death rate as to mortality rate is low as compared to the smallpox, but 3 to 6% in the Central African monkeypox, while it is up to 10%. I was reading the literature in the John Hopkins that they are expecting more than this, more than 10%. And I was also reading a literature that among 33%, 3% has died in the UK. So it can become aggressive. So what are the different complications? Is the secondary infection, bronchopneumonia, sepsis, encephalitis. And if the patient is suffering from the fever and the fever is not settling, it means the patient is going in the aggressive phase. Then pneumonia, most of the deaths have been reported due to this pneumonia. So be careful when a patient of this one. You also use the mask. The doctor must use the mask, and that again washing of the hands, again keeping the distance. These are the same measure that the corona has taught us. That is why it is very important for the doctors that if they do not know that either the monkeypox is coming in the globally, because now the world is globally, if any patient appear in any area can come in Pakistan. And you know the Pakistan is the most populated, almost fifth and sixth populated country of the world. So these are the symptoms that we described in our previous picture. This is the acute phase, and that is the second phase, that eruptive phase. This is the vesicles. This appear after 5 days, and then this is the second phase. Then a vesicle becomes pustule. This you are looking here the ulcers, and this is you are looking here the pustule, and after that this becomes scaly and crabby. I think this patient was reported from Pakistan in the social media on the 21st May. First patient of this monkeypox was reported at the 4th May in the UK. This person was reported in Pakistan, but I do not think that he has not taken the PCR. And what was his confirmation? According to the NIH, there is no patient of the monkeypox in the Pakistan. Again, this is very important that how you will diagnose the case. First important thing is the history, clinical examination. When the doctors are going to do, or medical students are going to do the clinical examination, they must wear the mask, and they must wear the goggles, they must wear the gloves, and they should be very careful in keeping away from the droplet infection and contact. And after examination, they must wash the hand about 20 minutes of the hands. So the diagnosis is almost same. After making the diagnosis, that is very important thing is that is the PCR. But the sampling technique is very important. Doctor must supervise the nurses and other technologists in taking the sample. If the sample is not appropriate, the report will be negative. Another important thing, the WHO reports that when the sample is appropriate and you are not transporting safely, this not only make the danger of the spread, but the report may be negative. So that is why, again, the type of the specimen, if you are taking from the pustule, taking from the vesicles, if you are, how much you have taken the specimen, and what are the tests you are going to be performed in the lab, PCR or something else. That is, these are the important precautions in making the, so PCR, when the taking the PCR, the doctors, the physician, the consultant, the general physician should supervise that the fluid, that you take the sample from the roof of the vesicle, or from the fluid of the vesicle, from the pustule, fluid of pustule, or the dry crust. And but do not take surrounding area, other area that may be possible. Another thing is the biopsy. If the crust is there, you take the biopsy, but the option, do not put the formalin in the specimen. You only store in a sterile tube and sent to the lab. That is why to make it so another very important thing, do not send the blood, do not send the saliva, do not send the semen, do not send the anal swab, because the viremia is very short duration that will make it the negative. And if the report is negative and the patient is back positive, that may false positive, false negative, that the danger is to spread the disease in other area. Another recommendation you are looking nowadays, the companies are telling you that antibody, antigen, or the serology test, these all are fake. Do not trust on this one. Only and only test is the PCR, and the PCR should be taken. This is another false positive. If anybody has taken the vaccination of the smallpox, that can give the positive. So the history before taking the specimen, or this all history should be sent, that's submitted to the lab along with the data of the age and the gender and things. So if the patient should, that is why the PCR, making the PCR, we should know that the patient has taken already the. So another information you submit, the when you are going to submit the sample in the fever stage, it may be negative. In the rash state, it may be negative. The only thing, when the vesicle, the pustule, the crust, and other thing, then the PCR may be sample. The collection of sample is very important. No, this was the diagnostic, important precaution of the diagnosis. Another thing, the precautions. Prevention is better than, as we Pakistani people, we know when we stand against any of the disease of any of this, we are always, we saw how we prevented the prevention, the transmission of the corona, and even the mortality of the corona. That is why my request is that you, if any of the person in Pakistan is there, first thing is that the general public awareness, then is the health caring bodies should be ready to handle this situation. And if some patients are coming in the Pakistan, then the solution is the vaccination. The vaccination is, I will let you know what is the name of the vaccination. So this is the vaccine, same vaccine, the smallpox vaccine, Jenios vaccine. These are the 2 doses vaccine after the 4 weeks. The immunity is only confirmed after the 2 doses. Yes, if you see the score, if you all people like of my age, there will be score on this arm, upper arm, that when we were in class 5, this smallpox vaccination was given to us. The smallpox vaccination is still effective about 85%, because I told you earlier that this is the little sister of the smallpox virus. The people in this new vaccine was introduced, that is called the Ankara strain in 2099, but still its side effects and its profile. Another important question is that when this vaccine is given, either can we give this vaccine to the patient? Yes, this is the only vaccine we can give to the patient to enhance the immunity, and other is to give this vaccine for the prophylactic purpose. This is the procedure to give the vaccine in the upper arm. And again, I am mentioning, give the 2 doses after 4 weeks. Same, we are feeling the problem in the corona, and in this vaccine, because this is the DNA vaccine, no booster is required. While in the corona vaccine, we will need the booster every year, because the corona is changing, mutating, while this virus is not. Prevention. In the prevention, first thing is the creating the awareness, and the governments and the other institutions and NGOs must do the surveillance and share, the countries should share the information so that we should know what are the different risk factors of this one. The educating the people about the measures they can take to reduce the exposure to the virus in the main prevention. And the policy makers should provide the vaccine that this disease can come anytime in the Pakistan. And if the any one case is there, then we should go for the vaccination. One important thing is that the question is either this, if you are vaccinated or I am vaccinated, can I get the monkeypox? No. If I am completely vaccinated in the childhood, there is no danger of this virus again. Only the people of the 40 years who have stopped the vaccination since 1970 and 20, they must get this one disease also. So another thing is that we must reduce the transmissions, handling of the patient, handling of the specimen, laboratory worker especially, and the people who are living with this animals. So the transmission can occur through the humans to humans. The transmission can occur from the animals to the humans, and transmission can occur in the doctors from taking the examination, doing the examination, and transmission can occur from the sample collection, or transmission can occur in the laboratories who are doing the PCR. So these are all measures that can reduce this transmission. Is there any treatment? Yes. First treatment is symptomatic treatment, that to watch the patient, quarantine the patients in the home, and almost quarantine the patient around about 21 days, and give the symptomatic treatment to not only to reduce this disease and to reduce the complication, and keep the patient on the fluid and good diet and good vitamin diet level, vitamin D level, and try to to reduce the risk of the secondary infections. Is there any drug? Yes, there are 3 antiviral drugs, but this drug is very commonly used with good safety and low complication and good tolerance to renal tolerance. And the name of this is teicovaramate. But I will request not to use your own self. You consult your doctors and consult your consultant, that he will adjust the dose and he will adjust that is this drug is required or not required. But for you should know that drug is available and very effective antiviral, teicovaramate. This is now being used in UK and being used in the Europe, and the demand is increased. No doubt, we all are complaining that they become costly. They are becoming costly everywhere, because when there is demand is high and the supply is low, there will be some malpractice. Another drug, these are the two drugs. These are the 2 drugs, cidofovir and briccidofovir. This cidofovir, the safety data is not available. The tolerance, kidney tolerance, renal tolerances data is not available. While briccidofovir, this is a new drug they are now introducing in the endemic area. They are not going to use in the non-endemic area. While immunoglobulin, these are used to people who are autoimmune, suffering from the autoimmune diseases, or the immunity is low. But once again, there is important thing is that there is no danger in Pakistan. Now I will summarize this. The summary is that the Pakistan, There is no one case in Pakistan. And second message is that all the diagnostic facilities are available in the Pakistan. And third is that this is the zoonotic disease. And fourth, that this is nowadays can spread from human to human. And I hope that we should be very careful. If any of the case comes in Pakistan, we should adopt all the measures we are adopting in the COVID. Thank you very much. And if you have any question, most welcome.
Thank you, Professor Bukhari. It was excellent and very comprehensive presentation. And I'll request whosoever wants to ask a question, please raise their hands so that we can take only the one. Okay. Professor Rashid Mahmood has some query. He has raised his hand, so I'll request Professor Rashid Mahmood. अच्छा, एक और चीज कर सकते हैं, देखें, अनम्यूट करने की जरूरत नहीं है. अगर if you are using your laptop, स्पेस बार को प्रेस करें, speak, and when you leave the space bar, आप automatically म्यूट हो जाते हैं. तो बजाय अनम्यूट करें और फिर हमें आपको म्यूट करना पड़े, तो use your space bar.
बहुत शुक्रिया डॉक्टर काजी साहब, ये आपने एक तो ये नॉलेज में इजाफा कर दिया. और मैं क्वेश्चन से पहले बहुत शुक्रिया अदा करना चाहता हूँ पाकिस्तान मेडिकल एसोसिएशन का, डॉक्टर काजी प्रोफेसर सलमा कुंडी और डॉक्टर प्रोफेसर मुलाजिम बुखारी साहब का कि सिलसिला दोबारा शुरू किया. बहुत यूजफुल से वेबिनार है. मुलाजिम साहब, मेरे दो क्वेश्चन हैं. एक ये कि क्या इस स्टेज पे कहीं हमारी गवर्नमेंट की तरफ से स्पेसिमन कलेक्शन पे कोई ट्रेनिंग का सिलसिला है? क्योंकि अगर कोई भी सस्पेक्टेड केस आता है तो लेबोरेटरी पीपल शुड बी ट्रेन्ड, तो कोई ऐसा सिलसिला स्टार्ट हुआ है कि नहीं? और दूसरा, अगर कहीं पे वैक्सीनेशन की स्टेज आती है तो क्या एज रिकमेंड करते हैं? क्योंकि मेरे ख्याल में ओल्ड एज पे तो किसी को रिकमेंडेड नहीं है, सब वैक्सीनेटेड हैं. तो क्या 30 से नीचे, 40 से नीचे, 20 नीचे, किन को वैक्सीनेशन रिकमेंडेड होगी? तो इन दो क्वेश्चंस को जरा.
थैंक यू वेरी मच प्रोफेसर राशिद. पहला सवाल ये है कि दैट इज व्हाई आवर फर्स्ट लेक्चर वाज टू क्रिएट द अवेयरनेस एंड हाउ टू कलेक्ट द सैंपल्स. I think in the laboratories are going to train the people to get the samples. I was discussing with one of the lab in the Aga Khan, and they told that their staff is trained in regarding in NIH. There is also very trained, but important thing is the patient cannot go in the NIH. Only the sample will go. So that is why it is very important. It is for us to create the awareness how to diagnose and the collection of sample. This was, I think, still there is a data is not available. I hope the people will create awareness the collection of the sample. Second, because the sample was very important, technique of the sampling, sending it of sampling can create the spread of the transmission of the disease. So these things we will continue as one by one and to create the information. Second data is that regarding the smallpox vaccine, I cannot comment. I do not have the answer, but I was reading the literature in the UK. The companies now they are reproducing, but because this vaccine was stopped after 1918 and the trend of the vaccination but because now there are more than 300 cases in the world, the WHO is aware to produce the vaccine. They have ordered the companies to reproduce the, and I think when there is case in Pakistan, the Pakistani government will get the vaccines.
तो सर एज क्या रिकमेंड करते हैं, किस एज से नीचे? क्योंकि बूढ़ों को
I have mentioned above 18 plus.
18 plus. और हम लोगों को भी, क्यों हमने तो लगवाई हुई है वैक्सीन अभी.
If you are vaccinated in the child, I discussed in my slide. If you are vaccinated, I am vaccinated. I am not in danger of, because my immunity is there. My memory cell will awake again, and they will generate the antibody. The people who are vaccinated, they are not in danger of getting the monkeypox.
Thank you.
Hello, can I ask a question, sir, please?
Dr. Naeem.
Sir, it was indeed a very nice talk, and this is a nice awareness program among the community. Excellent, Professor Mulazim Bukhari Sahab. But my basic question is, if there is no such case, why we are
Other
worried?
people stop
Question
because
number
the
one.
voice is mixing. Naeem, I am not hearing.
Yeah, my basic question is, Bhai Sahab, Dr. Naeem again, that if there is no case, such case in Pakistan, then why we are worried? That is question number one. My question number two is, as you have very nicely said and very nicely repeated it, that there is, if you are vaccinated, there is nothing to worry about.
Yes,
So
yes.
when there is
If you are already vaccinated, you are no worry about it.
Okay, but if there is no case, then why we are?
Yes,
what is the
still,
worriness level here?
Yes, because you know there are round about more than 33 cases in UK, in Ireland, in Spain, and that is why the WHO has warned the countries, because now it is spreading in 21 countries, not in Pakistan, I think. But if the flights are coming, then the peoples are coming, and there is, because this can spread from droplet to droplet infection. So that is why the WHO and government even of Pakistan has warned in their newspaper that you should be careful about this disease.
Okay, thank you.
Okay, thank you, Dr. Badr Naeem. I'll request Dr. Munir. He has raised his hand to ask the question. Dr. Munir.
हेलो अस्सलाम वालेकुम सर।
वालेकुम अस्सलाम।
सर जी ये पूछना चाह रही थी कि आपसे, अगर वैक्सीनेशन हो चुकी हो तो वो कहते हैं दूसरी डोज मतलब के लगवा लें 4 मंथ के वक्फे से, तो ऐसा हो सकता है?
आप इसकी कह रहे हैं अपनी मॉन्की पॉक्स की या कोविड की कह रहे हैं?
सर कोविड की।
कोविड की जो है कि कोविड का तो आपको कहा है कि अभी अगर बूस्टर डोज लगवा लें, अगर आपको 6 महीने हो गए पहली डोज दूसरी डोज लगे हुए, और उस वक्त तो ये है कि कोविड के बारे में तो ये है कि आपको हर साल लगवानी चाहिएगी, क्योंकि कोविड इज नॉट ओवर।
यस सर।
Thank you for permitting me to have a comment or a question. This was a very
informative. You are in Kashmir, I think.
Yes, I'm in Kashmir. I'm in my room. It was a very informative lecture. I just have a comment that some of these zoonotic diseases, the best thing about them is that they are not transmitted from humans to humans. But this is a particular disease, you see, you have talked about it. The worst thing about it is that it can be transmitted from the humans to humans. That's why it is more alarming, and we have to be on our toes about this disease. It was a nice, informative talk. Thank you very much, sir.
Okay, I don't see any raised hands. Is there any question from the participants?
Yes, one thing. Please, if because as Professor Mulazim Bukhari has mentioned that those who are more than 20 years or 30 years old, they don't need a vaccination. Yes, but is there a possibility that the immunity level must have declined to an extent that those older than 40 can get the disease? So is there a possibility of getting an antibody testing checked?
Dr. Malik Mahmood, you are a hematologist. I know this is very important questions. You all know when we were vaccinated with polio, with smallpox, with rubella, with others, our antibodies are raised, our antibodies are developed, but with the passage of time, when there is no infection, our memory cells sleep, and whenever there is infection or antigen come again, our memory cell will reawake, and they will start immunoglobulin. So that is why the literature is telling, and the history of the patient who are getting infection in UK, they are homosexual, one thing, and second thing is they have not taken the smallpox vaccination. So I think this is the good hope, and that if you and me or other people are vaccinated in Pakistan and other countries, there is no danger of going to get this disease. ये देखें कि अगर वायरस आना है तो हमारे जो इम्यून सिस्टम को जागने में 24 से 48 घंटे लगते हैं. हो सकता है बुखार हो जाए, सर दर्द हो जाए, लेकिन इरप्टिव स्टेज और एग्रेसिव स्टेज की तरफ नहीं जाएगा, क्योंकि आफ्टर 48 आवर डेफिनेटली हमारे मेमोरी सेल जो है कहीं ना कहीं बोन मैरो में पड़े होते हैं, वो उसकी जाग जाते हैं और उसकी फौज तैयार हो जाती है और इम्यूनोग्लोबुलिन बनना शुरू हो जाती है.
थैंक यू.
बहुत शुक्रिया. मुलाजिम साहब, मेरा एक सवाल आपसे होगा कि ये हाउ रेगुलरली इट हैज बीन कमिंग अप, क्या पहले इसकी क्या तारीख है कि ये मॉन्की पॉक्स जो है कब कब आता रहा है?
जी, मैंने आपको बताया द फर्स्ट केस वाज रिपोर्टेड इन नाइजीरिया एंड आई थिंक कांगो इन 1970 में पहला केस रिपोर्ट हुआ. ठीक है, फिर इसके बाद एंडेमिक एरिया यानी वो अफ्रीका, सेंट्रल अफ्रीका और वेस्ट अफ्रीका, वहां पे ये केस रिपोर्ट होते रहे. इसके बाद 2018, 2019 और 2020 में जरा एक थोड़ा सा केस ज्यादा हुए. इस दफा पहली दफा ऐसा हो रहा है 2022 में कि नॉन एंडेमिक एरियाज के अंदर भी ये लोग आ रहे हैं, और उसलिए दे आर लकी कि वो बता तो देते हैं कि हम नाइजीरिया से आए हैं, ताकि उनको पता चल जाता है कि प्राइमरी सोर्स क्या है. हमारे यहाँ तो कोई बताएगा भी नहीं कि हम कैसे आए हैं. तो एक्चुअली पहले 10-20 केसेस से ज्यादा नहीं होते थे, इस दफा 300 केसेस हो गए.
बिल्कुल, ये बहुत अलार्मिंग है सिचुएशन, और आपने बहुत अच्छा आज इस टॉपिक को कवर किया है, और मेरा ख्याल है कि डॉक्टर्स कम्युनिटी के अंदर भी बहुत ज्यादा इसकी अवेयरनेस की जरूरत है. अच्छा, एक और मैं आपका कमेंट चाहूंगा कि ये जो हम अर्बनाइजेशन पे जा रहे हैं, वी आर गोइंग ऑन डिफॉरेस्टेशन, इंडस्ट्रियलाइजेशन पे जो हम जा रहे हैं, और जो जानवरों के जो हैबिटेट है, जो उनके रहने की जगह है, उन्हें कम करते जा रहे हैं, उन पे हम इंसान जो है वो कब्जा करता चला जा रहा है, और पॉपुलेशन ग्रोथ के ऊपर हमें ज़ाहिर काम करने की जरूरत है. डिफॉरेस्टेशन पे जरूरत है. हमारे जो एग्रीकल्चरल लैंड है उसे हम अर्बनाइज करते चले जा रहे हैं. तो इसके बारे में जरूर कमेंट कीजिएगा, क्योंकि ये बहुत अहम इशू हैं. पॉपुलेशन ग्रोथ, डिफॉरेस्टेशन, इंडस्ट्रियलाइजेशन, अर्बनाइजेशन, इसके बारे में जरूर आप कमेंट करें, और इस पे हम सबको काम भी करना है.
बिल्कुल आपकी बात ठीक है. एक तो ये है कि पाकिस्तान अगले चंद सालों में दुनिया का तीसरा बड़ा मुल्क हो जाएगा पॉपुलेशन के हिसाब से. ये एक बहुत अलार्मिंग है. और जो रूरल एरिया से लोग, अब इंडस्ट्रियलाइजेशन तो नहीं है बल्कि अर्बनाइजेशन ज़्यादा हो रही है, उस अर्बनाइजेशन की वजह से ये बहुत इम्पोर्टेंट सवाल है कि इससे हमारा जो लाहौर अगर देख लूँ मैं, तो लाहौर स्मोक से भरा हो जाता है, जिससे हमारी इम्यूनिटी बहुत कम होगी. सारी डिजीजेज जो हैं इम्यूनिटी पे बेस्ड होती हैं. जो अगर जिस तरीके से हम जा रहे हैं तो उस तरीके से, दैट इज व्हाई रिपीटेडली वी आर फेसिंग डिफरेंट डिजीजेस. कोरोना आ गया, फिर कोई चिकन पॉक्स आ जाएगा, फिर इसके बाद कोई और डिजीज आ जाएगी. आप हैरान होंगे, हेपेटाइटिस सी जो है वो पाकिस्तान दुनिया का सबसे बड़ा मुल्क बनने जा रहा है. आपको एक और खतरनाक बता दूं, प्रोफेसर मुनीर भी बैठे हैं, माइक्रोबायोलॉजिस्ट बैठे हैं, एड्स फैलाने में पाकिस्तान नंबर 1 होता जा रहा है, फैलाने में नंबर 1 होता जा रहा है. तो दैट इज व्हाई आई थिंक एट योर प्लेटफॉर्म, एट माय प्लेटफॉर्म, एट द प्लेटफॉर्म ऑफ अदर पीपल, वी मस्ट क्रिएट द अवेयरनेस कि अपनी इम्यूनिटी को बेहतर रखो, अपनी इम्यूनिटी को बेहतर रखो, अपनी इम्यूनिटी को बेहतर रखो. इम्यूनिटी बेहतर है तो हमें उसके साथ हमें इंशाल्लाह वो होता जाएगा. That is why the government should develop the laws कि देहातों को डेवलप किया जाए, एग्रीकल्चर एरियाज को डेवलप किया जाए, ताकि लोग शहरों का रुख ना करें। ये दुनिया के जितने डेवलप कंट्रीज हैं, आप गए होंगे, पेरिस जाएं, जापान जाएं, वो के देहात इतने खूबसूरत हैं, दिल करते हैं वहां जाएं, शहर जाएं ही ना। दिस इज द क्वेश्चन ऑफ योर आंसर ऑफ योर क्वेश्चन सर।
बिल्कुल, बहुत सही बात की। और मैं तो एक और
डॉक्टर नईम ने कुछ सवाल पूछा है, डॉक्टर नईम ने हाथ खड़ा किया है।
अच्छा, वो एक से वेरी इंपॉर्टेंट, आपको आवाज आ रही है मेरी?
जी हाँ, बिल्कुल।
इज ए वेरी इंपॉर्टेंट एस्पेक्ट जो वासिक काजी साहब ने रेज किया है। आई थिंक द बिगेस्ट इशू ऑफ आवर कंट्री is a population explosion. I think we should take a chance from this forum to extend our concern to the higher authorities. There should be a positive measure should be taken to look into this matter. So I think और हमारे challenges से मैं समझता हूँ कि बल्कि आप लोग भी मुझसे agree करेंगे कि this is the very important challenge which the Pakistan is facing is a population explosion. तो इसके ऊपर थोड़ी तवज्जो की जरूरत है, इससे काफी सारी मसाइल का हल आपको मिल जाएगा। शुक्रिया।
बहुत सारी तवज्जो की, बहुत सारी तवज्जो।
बिल्कुल सही कहा आपने। और मैं तो एक और बात करना चाह रहा था कि ये जो हम देख रहे हैं कि एनिमल वायरसेस जो हैं वो म्यूटेट करके एनिमल टू ह्यूमन ट्रांसमिशन में हो जा रहे हैं। कोविड भी हमें एनिमल से ट्रांसमिट होके और ह्यूमन में आया, और अब ये आज आपने मॉन्की पॉक्स के बारे में बात की, तो आई डोंट नो कि आइंदा आने वाले वक्तों में, क्योंकि हमने जो एनिमल हैबिटेट है उनमें घुस गए हैं, हमने जो है वो जंगलों और उनको जो है अपने रिहायशी इलाकों में तब्दील किया है, और वहां से फिर ये जानवरों के जो वायरस हैं वो म्यूटेट करके ह्यूमन ट्रांसमिशन उसकी बहुत हो रही है।
ये कैसे, मैं आपको इसका एक जवाब दे दूं। बात यह है कि पाकिस्तान इस लिहाज से ऐसा है कि हमारे यहाँ जानवर को कोई इतना प्रॉब्लम, हमें जितनी भी डिजीजेज मिलती हैं ना बाहर से मिलती हैं, कि हमें चाहे कोरोना आया है तो बाहर से आया है, एड्स आई है तो बाहर से आई है, हेपेटाइटिस आया है तो बाहर से आया है, तो इवन ये मॉन्की पॉक्स आ रहा है तो बाहर से आ रहा है। क्योंकि हम लोग जानवर, हमें मुसलमान हैं, हमारा एक सिस्टम ये है कि हम अपनी सफाई का ज्यादा ख्याल करते हैं। एनिमल्स के हिसाब से जो ये वाइल्ड एनिमल्स हैं, ये जानवरों के साथ अननेचुरल लाइफ वो गुजारते हैं वो लोग। और ये जो अब वाली डिजीज आपको बताएं, ये सारे होमोसेक्सुअल्स हैं। हमारे यहाँ तो ये बहुत बड़ा गुनाह है। तो इसलिए दैट इज वाई ये जितने भी पाकिस्तान में बीमारियां ज़ूनोटिक की आ रही हैं, ये सब की सब बाहर से आ रही हैं। हमें क्या करना चाहिए? हमें वही वाली बात जो अभी आपने और डॉक्टर बदर नईम ने कही है। प्रोफेसर बदर मेरे क्लास फेलो भी हैं बचपन के, और ये प्रोफेसर ऑफ आई इन रावलपिंडी मेडिकल कॉलेज। तो ऐसा है कि हमें इन चीज़ों के ऊपर तवज्जो देनी चाहिए कि हम क्या करें, अगर आ गई तो हम क्या करें। हमारे यहाँ ये चीज़ें हम इस हिसाब से हमें ह्यूमन टू ह्यूमन को कंट्रोल करना है। हाथ मिलाना, अस्सलाम वालेकुम जी, क्या हाल है जी। अब वो जो पहले गले मिलते जी, अस्सलाम वालेकुम जी। तुर्कों वालों ने एक ड्रामा था, उसने बड़ा अच्छा रोल अदा किया कि हमें जी अस्सलाम वालेकुम जी जी जी। उसके बाद इसके बाद एक बड़े बड़े इक़दामात से जरा थोड़ा जो है मास्क लगा लें। मास्क हमारे सारी जिंदगी अडॉप्ट करना पड़ेगा, क्योंकि हम ग्लोबलाइज लाइफ है, बाहर से बीमारी आ गए तो पाकिस्तानी क्या करेंगे। हमें अपनी हिफाजत करनी चाहिए, और अल्हम्दुलिल्लाह हमारी इम्यूनिटी बेहतर है, जिसकी वजह से हम कोरोना से भी बच गए और इंशाल्लाह इस बीमारियों से भी बच जाएंगे।
बहुत शुक्रिया मुलाजिम साहब। मैं देख रहा था, मेरा ख्याल है सलमा कुंदी साहिबा प्रेसिडेंट पाकिस्तान मेडिकल एसोसिएशन, शायद उन्होंने ज्वाइन किया था, उनका मैंने मैसेज देखा।
मेरी बेगम ने मेरी इम्यूनिटी बढ़ाने के लिए सत्तू का गिलास दिया है।
सॉरी जी, आई can't join you in time. 5 मिनट के लिए उनसे माफी मांग के बाहर निकल आई हूँ। इंशाल्लाह ये रिकॉर्डिंग तो मैं सुन लूंगी, लेकिन I want to thank everyone and I want to apologize. I don't think it's
मैडम सलमा, क्या मेरा ख्याल है नेट का प्रॉब्लम हो रहा है, Anyway, with her closing remarks, जो कि अभी उन्होंने मेरा ख्याल दे दिए हैं, we end this. If
Can
there
you
are
hear me now?
Yes.
Yes, madam.
I want to apologize. I have Amaji, I have friends at home. I have the guests at home, so I couldn't attend it. Please, Dr. Kazi Saab, आप मेरी तरफ से vote of thanks कह दें, and my sincere apology to everyone. Thank you so much.
हम आपके ही closing remarks हो जाएंगे. बहरहाल, anyway, from on behalf of Madam Salma Kundi, President Pakistan Medical Association, I'm really thankful to all the participants, especially those who actively participated in the discussions. It was a very nice presentation by Professor Mulazim Bukhari, covered almost everything about the monkeypox. And thank you very much, all the learned doctors present here. And we close the session now. And thank you, everybody. Thank you very much. Khuda Hafiz.
Thank you so much. Thank you very much. Assalamu alaikum. Assalamu alaikum. Allah Taala आप सबको हिफ्ज़-ए-मान में रखे.
Allah
आमीन।
Hafiz.